my name is Richard, and I'll be going over an ABG competency. What's an ABG? It's a specialized blood draw, and it's specifically looking for values that you can't get through a non-invasive procedure, like a transcutaneous monitor, pulse oximeter, and a capnometer. You'll be looking at values like pH. pH bicarb, PCO2, PO2, and that'll be a basis of the direction of your treatment for the patient. Before going into the patient's room, we would be looking over their chart, and we'll be looking for contraindications such as presence of shunts, skin grafts, allergies to anesthesia, as well as anticoagulant treatment that could be anything that basically could affect the treatment. Once we review the chart, we can gather our equipment. Typically, it's a good idea to have two kits, ABG kits, and ABG kits would include a heparinized syringe, a 2022 gauge needle, Band-Aid gauze, as well as an iodized pad, and a alcohol prep pad. They will have also the collection bag and requisition strip, usually two, one going over the bag itself and the other one on the syringe. And on the slip, you would be putting the patient's information, the name, time and date, if they happen to be on the ventilator, what the ventilator settings are, the temperature, or if they happen to be on oxygen, what kind of oxygen this is on. Anything along that line might affect the results. Once we're ready, go ahead and knock on the door. Enter, introduce myself, Richard with Respiratory Care. We're going to be doing a procedure with you. May I have your name and date of birth? You would use that to compare to the wristbands, just to make sure that's the correct patient. You do your hand sanitization, so alcohol hand sanitizer or soap and water if your hands are visibly dirty. It's about 15 seconds with soap and water. You would wear gloves. In this case, I don't have one on me right now. Let me grab a pair of gloves. Some preparation, And at this point, I can explain what I'll be doing with the patient. We're going to be doing a specialized blood draw. It's going to be drawn through the artery instead of the veins, and it's specifically looking at the functions of your lungs. There are some potential side effects, such as bruising, bleeding. There could be some pain, but we'll do our best to prevent that from happening, and it will be as gentle as possible. We'll be here as long as it needs to be. So usually you wear gloves about a size smaller than you usually wear. It helps you palpate where the site would be. Once we position the patient's arm, you would bring with you some rags, some towels to help hyperextend the wrist, and that will bring the artery up closer to the surface. You can do the Allen's test, and where you can occlude both the radial and the ulnar arteries. Have the patient pump their hands about 5 times. Thank you. Please open and close your hands about 5 times. All right, thank you. And just release. And you should see the blood and the color come back in about 5 to 10 seconds. That would be a positive result. If it's more than 10 seconds, it's a negative result, and you will be looking at the patient's other arm. If the patient is unable to cooperate, you would go ahead and still occlude, and then you would massage the palm and release the ulnar and see how quickly again the blood comes back into the palms. Thank you. We once we got the arms prepared, we'll go to palpate, and we'll be using the radial artery. Other sites possible would be the brachial and the femoral. Um, Go ahead and prepare your equipment. We have our syringe with the stopper. And you would position your equipment best for you. With the patient's approval, I can put the sponge or the swab prepared, put it on the crook of the patient's arm, and the band-aid. And again, we'll have the alcohol prep swab as well as the iodine. And the requisition form I would fill out at this point and have that ready. And I can go ahead and palpate. Find where the artery is. Take your time as need be. You should locate the site and go ahead and clean the site. The iodine pad, you would go in a 2-inch area. You'd start from the center out, and followed by the alcohol swab. And again, from the center out, you wouldn't want to blow or fan the site to dry the alcohol. It might introduce contaminants back into that site. Once that's done, and you have it palpated, find the site that you want to go. I will tell the patient to and talk to the patient and the family, and just to prepare them. You would draw the syringe to about 1 cc. And there's a lot of variation on what kind of sample size the patient they would require. And it could be because of the equipment. There could be things that could occur that you may have you need extra samples. And I would prepare the patient that they'll be going in. So this might hurt, but depends on the situation, and it will hurt more if you move around. So try to keep still. We're going to do this as best we can and as gently as possible, and I'll be here as long as it takes. Okay. So we do have 2 attempts. If we miss the first time, we can pull back, leave the bevel in the skin, and then redirect once. And we can do a second attempt, and that's why we have a second kit. If we miss twice, then basically we're done. We're going to have to inform another RT to come in and try again. So when we're ready, we'll be holding it in a 35 to 45 degree angle with the bevel down. If you're going on the brachial, it would be a 60 degree angle. Femoral would be 90 degrees. One finger would stabilize the artery. Go ahead and lift the finger. Go on the inside and look for the flash. There's your flash. And it's pressurized, so the blood will just fill that space. And when we're ready, go ahead and pull back and apply pressure. Now typically it would take about 5 minutes on most patients, but if the patient happens to be on anticoagulant treatment, it may take longer. So we're looking at 10 minutes or however long it takes. You never leave the patient with an active bleed. With the other hand, go ahead and put this on the stopper. Unscrew. And I'll be more prepared than this, but use the cap to put this on. and you would inspect the sample for air bubbles. Tap it to get rid of them, otherwise it will affect the results. Um, there are heparin in here too, and that could potentially change increase the reading on the pH, as well as lower the carbon dioxide reading as well. So just keep that in mind. And you go ahead and do the figure eight, and that would mix the heparin. You do have 15 minutes to get the sample to the lab to get it analyzed. If you do anticipate that it's going to take more than 15 minutes, a cup of slushy ice may be a good idea. That would extend the life of the sample to about 1 hour, no more than an hour. Once that is complete, patient stop bleeding, apply the band-aid. The band-aid really is it's a comfort measure. It shouldn't be needed, but again, if there's a bleed, you never leave the patient. Um, it has to be complete first. You'd put your sample, your requisition strip on the syringe and in the sample bag. You would clean up your area. Garbage goes into a appropriate receptacle. The needle goes into a sharps container. Before leaving the patient, you make sure you ask them if they're okay. Is there anything else you need? Do you need anything else before I go? If the patient's okay, go ahead and do your hand sanitation. Dispose of your gloves. Wash your hands or use the hand sanitizer. And go ahead and go to the lab. Have your sample analyzed. Go ahead and interpret your results. Have recommendations for the physician and nurse you'll probably be presenting to. Chart your results, and while you're interpreting the results, see if it kind of fits the clinical manifestation for the patient. And I believe that's it. Thank you for listening.